The Health Development Fund, a multi-donor pooled fund to the health sector, supported the implementation in Zimbabwe of the reproductive, maternal, newborn, child and adolescent health and nutrition activities since 2016. The fund was led by the Ministry of Health and Childcare, which pooled funding from the European Union, the governments of Ireland, Sweden, and the United Kingdom, and Gavi, the Vaccine Alliance. Technical support was provided by the United Nations Children's Fund, UNICEF, and the United Nations Population Fund, UNFPA. More than 30 partners, including ministries, were involved in the implementation of the Health Development Fund activities. The Health Development Fund supported UNICEF, UNFPA, and more than 30 implementing partners to work with the Ministry of Health and Childcare in 7 key thematic areas of 1. Maternal, newborn, and child health and nutrition. 2. Sexual reproductive health and rights. 3. Medical products, vaccines, and technologies. 4. Human resources for health. 5. Health financing. 6. Coordination, planning, monitoring, and evaluation. And 7. Technological research and innovation. The Health Development Fund ensured key achievements for equitable access and quality healthcare in Zimbabwe for women, newborns, children, and adolescents. Regarding maternal, newborn, and child health, 92% of district hospitals are now able to provide comprehensive emergency care, including cesarean sections and blood transfusion. The Health Development Fund also contributed to maintaining the availability of essential medicines and commodities in primary healthcare services at an average of 80%. The distribution of essential medicines was successfully harmonized with the distribution of nutrition commodities. Since 2016, the Health Development Fund, through UNICEF and partners, ensured funding to 849 primary health facilities through result-based financing, which provides an operational budget that ensured the removal of user fees for maternal and child health services. 30 health facilities were solarized with funding of the Health Development Fund, ensuring reliable water supply and improved quality of healthcare services. Solar energy is a reliable energy source that has ensured uninterrupted service delivery to women and children at the remote healthcare facilities. The Health Development Fund supported the recruitment, training, deployment, and retention of a well-equipped community of health workforce, allowing the Ministry of Health and Childcare to recruit an additional 4,780 village health workers. More than 80% of the villages in Zimbabwe are now benefiting from the presence of at least one village health worker. Thanks to the support of the Health Development Fund, 9,264,000 people now have access to community-based health and nutrition services. The Health Resilience Fund, the successor to the Health Development Fund, will ensure technical support to the Ministry of Health and Childcare in developing policies to address issues such as staff retention and sustainability of primary healthcare delivery. Finally, the Health Development Fund also supported the planning and coordination of health activities at national and subnational levels, including the annual planning and review meetings of the Ministry of Health and Childcare and technical and financial partners, while at subnational level, support was provided to provincial health team meetings across the 8 rural provinces. In 2020, the Health Development Fund quickly adapted to the challenges caused by the COVID-19 pandemic and contributed to the National COVID-19 Response Plan. The fund supported risk communication and community engagement activities, the treatment of COVID-19 cases, and the procurement of medical supplies and equipment. Community engagement was essential to ensure acceptance and uptake of COVID-19 vaccination. The Health Development Fund invested in and strengthened the existing systems and structures of the Ministry of Health and Childcare, which have proven to be cost-effective, helped cut redundancies, and enable the government with the empowered village health workers and engaged communities to sustain the health interventions. The fund contributed to an increased access to health services and a reduction of child and maternal mortality. Maternal mortality, for instance, was reduced from 614 to 462 per 100,000 live births between 2014 to 2019. The Health Development Fund also facilitated life-changing interventions to prevent and respond to gender-based violence, providing safe spaces for mentoring vulnerable adolescent girls, strengthening of parent-to-child communication around sexual and reproductive health and rights issues, and implemented a campaign to end obstetric fistula. With the support of the Health Development Fund, UNFPA and partners launched the Sister to Sister Girls Empowerment Program, reaching different communities and equipping them with vital information on sexual and reproductive health and rights and gender-based violence. The program sought to combat the harmful practices of child marriages and teenage pregnancies. The program was key in establishing safe spaces where vulnerable young girls can receive information, counseling, and support in relation to sexual and reproductive health and rights, enabling them to make informed decisions around their reproductive health, financial literacy, cohesive relationships, and other gender-related issues. The program also assisted girls to fight poverty and to pursue their education. Over 105,300 girls have been recruited in the Sister to Sister clubs in Zimbabwe as a result of the support by the Health Development Fund. The Health Development Fund also supported access to healthcare services for key populations. UNFPA has worked with partners to respond to the challenges commercial sex workers face. As a result of the interventions, commercial sex workers have been able to gain life and job skills, including education on their rights as sex workers and critical information on the correct and consistent use of protection against sexual communicable diseases. The Health Development Fund supported the strengthening of integrated sexual reproductive health and rights, HIV, gender-based violence, and adolescent health across the country. Towards the zero maternal deaths objective, health facilities were supported with essential equipment, including for emergency, obstetric, and neonatal care. Life-saving equipment included anesthetic machines, Dopplers, anesthetic tables, delivery beds, resuscitators, and blood pressure machines. Health workers were capacitated in family planning, while mentorship was conducted by provincial technical teams. The Health Development Fund supported the government of Zimbabwe in setting up the National Cervical Cancer Screening Program, making use of visual inspection with acetic acid and cervicography. Thanks to the support of the Health Development Fund, there are today over 105 health facilities offering cervical cancer screening services. Over 925,000 women have, as a result of the program, been screened for cervical cancer at government health facilities. With support of the Health Development Fund, activities were developed to restore hope and dignity to women and girls suffering from obstetric fistula, a birth injury prevalent amongst poverty-stricken communities who may not afford healthcare services, and among young girls who become pregnant while still physically immature. Through the campaign to end fistula, With support from the Ministry of Health and Childcare, the Health Development Fund and partners, young women gain new lease on life through surgery at the fistula camps. Over 600 obstetric fistulas were repaired. Some key lessons learned through the Health Development Fund supported programs include the effectiveness of targeted mentorship of vulnerable people and on-the-job training of health and social workers. It helps with skills development in real time and for specific interventions. Providing integrated services has proven to be cost-effective as it maximizes the use of scarce resources and cuts down on patient waiting time. These lessons will be further operationalized as the Health Development Fund moves into the Health Resilience Fund.